So recently, the law firm Thomson Rogers filed a $20 million class action lawsuit against Sienna Senior Living Incorporated, which owns Altamont Long-Term Care Facility. This lawsuit was filed on behalf of the residents of this long-term care home and their families. Now, in case you guys don't know, Altamont Care Facility, it is one of the long-term care homes that's in Ontario. It's in Scarborough. It's one of the centers in the province that has been incredibly affected by COVID-19. In fact, to date, 53 residents of Altamont Care Center in Scarborough have died, unfortunately, due to COVID-19. The reason why this class action lawsuit was filed against this long-term care home was because there is just deplorable conditions that are going on in these long-term care homes. The military actually, I'm pretty sure you guys remember this, but the military was sent to 5 long-term care homes in the province, right? And Altamont was one of the long-term care homes that they visited. It honestly makes you feel sick to your stomach when you realize just the abuse that the elderly people are facing within these homes. For example, some facilities are not even feeding their residents 3 times a day. And even if they are, there's just inadequate nutrition because the food that they give to the residents, oftentimes it's not made within house. They order this food from catering companies that they put God knows what into the food, and it's just all a bunch of processed bullshit. And it's disgusting because these are our elderly population and people are paying these private homes and they're just being abused. Also, Thomson Rogers, they reported that back in 2019, the Ministry of Long-Term Care Homes, they had cited this same long-term care home because they had very poor, or actually a lack of infection control programs in place. Altamont, they showed a complete disregard for proper infection control programs. They would keep infected residents and non-infected residents together. As you can see, that's a problem because you need to be having people who are infected be in self-isolation because of the nature of how COVID-19 is spread, right? Another thing that has been discovered in these reports that the military conducted on these long-term care homes is that personal support workers have even apparently displayed neglect or even abused residents, right? When the military first arrived at Altamont and other long-term care homes, they discovered that these residents were bedridden for weeks. And as a result of them being bedridden for weeks, they had pressure ulcers develop. My whole point of this video is that this for-profit model that we have right now for long-term care homes, it has to be eliminated. It's just not the right way to go because we have these companies that are profiting off of our most vulnerable people, and it shouldn't be that way. Long-term care homes, they should be funded just in the same way that the fire departments are funded, just in the same way that education is funded. It should be publicly funded because these private companies, they're just going to cut corners to maximize their profits. They don't give a crap about making sure that the residents are being taken care of. Another problem too is the inspections that the ministry take, they're often about just handing out punitive measures. It's not about making sure that these resident homes are, enacting high level quality care. It's all about just logging to make sure that they have the things that they need in order to run. I'm just going to give you statistics just to show you why these for-profit long-term care homes are problematic and a public version would be more safe. In fact, there was a 2015 study that showed that within the year that they were conducting the study in private facilities, 11% of residents died, unfortunately, in these private care homes. And they also found that about 25% of residents reported at least one hospitalization. So as you can see, our grandparents are just not safe in these homes. There's just a bunch of scumbags that run these homes, and what they really care about is just maximizing their profits for their shareholders. And this study in 2015 also found that after following up for 12 months, residents in private facilities had an annual hospitalization rate of 462 per 1,000. And that's in comparison to 358 per 1,000 in the not-for-profit home. One of the ways in which COVID-19 was able to just ravage through these long-term care homes is the fact that the personal support workers, they were spread out too thin because the wages are really bad. And in order to find stable employment in this industry, it takes years. So what happened was a lot of these personal support workers, they would work at different facilities in order to make ends meet because they were making peanuts. So there needs to be better wages. There needs to be longer hours for these employees. These facilities, right? They were cutting a lot of staff to save on money. So another thing that has to be talked about is making sure that there are less cuts to staffing because The more staff there are, the better their pay is, the better care that they can give out to the residents. Hopefully the Ontario government make the necessary changes, and there should be criminal charges involved in this as well too. These are the people's lives that we're talking about. But yeah, that's my 2 cents on that. If you like this video, make sure to click that like button and click on the subscribe button and hit the bell so you never miss a notification. As always, thank you very much for watching. Till next time.